My experience with burnout, as I'll delve into, started from my own experience as a physician. And I experienced burnout for the first time when I was a medical student in Egypt. And then I moved to the States thinking that I would experience medicine in a much more fulfilling way. And I realized that the pressures on me when I was in Boston are even way more. And even though the hospitals were cleaner and the research was much more advanced, there was still something kind of gnawing at my soul, really. And my journey has been one of essentially trying to go beyond burnout, or trying to figure out what brings me fulfillment in life. And so I was fortunate enough to be able to switch careers. And so after my internship year, I went into clinical data analytics and started working with insurance companies around the States. And, so I had a job that was fulfilling to some level, included a lot of travel. It was very hectic because I was a consultant, but I really grew in this area of data analytics. And I was working with these insurance companies to help them understand how to make sense of clinical data. And that brought me back to square one, because after years of working with the data from the electronic medical records, we realized that the quality of the data was really low to an extent that we can't tell which provider did which procedure. And that brought me back to the problem of burnout again, and I didn't understand that it was burnout when I was younger. I just thought I was depressed and tried to deal with it as such. But then over my years as a consultant, I realized that the idea of clinical document integrity and what we're trying to do right now with electronic medical records and digital health is so deeply intertwined with burnout that we can't separate them. And we can't separate the quality of compassionate healthcare, which is the industry of compassion, from how compassionate doctors feel towards themselves and therefore towards their patients, but also how organizations provide this compassion to physicians. And so I've left my consulting job as well, and now I'm focused on researching and speaking about physician burnout, because I wholeheartedly believe that now more than ever is the time to deal with it, and organizations simply can't afford to go further in the way that we've been doing things. Yeah, what I'm going to be talking to you guys about today is how we're going to be healing burnout with healthcare data. And so essentially, there's so much that we can be talking about, and there's so much that I'm going to share. There's this problem of burnout is not just a wicked problem, but it's also been really well documented. And so there's a lot of resources that I can share. And if you're a physician and you're interested in like the background data, just go to this domain and leave your email, and I'll leave my contacts in the end too, and I can send you all these studies that I based this conversation on. And so what I'm going to be talking about today is like any disease, like what are the signs and symptoms? How can we address it? And then finally, how can we, what's the future going to look like when burnout is, when we've solved burnout? There are so many things that we can say when it comes to burnout, and specifically what I want to focus on is what is that dashboard that can ultimately show us what is going on with burnout. And I'll give you a lot of evidence-based techniques and evidence-based ways to both identify it, measure it, and then deal with it. And ultimately, there's so much research. It's a really well-studied problem. So if you are a physician and you're interested in learning more, getting these resources, just leave your email in the form with gumption.health, and I'll send you a lot of this information. What I'll be covering today is first, how do we identify it and how do we measure it? Like any other disease or condition that is serious, how do we look at the symptoms, signs, and then treatment, just like we would for anything in healthcare? But then what is our roadmap for recovery? What things should we be measuring, and what kind of ways do we have to deal with it out there? And then finally, I'm going to leave you with a glimpse of what the future of the world looks like without burnout. And so you've guessed it, my interest in this whole situation comes from me, myself, being burnt out. And like we were talking a little bit ago, like I didn't recognize it as burnout. And so I think the most important thing is to start looking at the symptoms, and the symptoms are phrases that we tell ourselves, really. And so according to Christina Maslach, here are some things that I was telling myself on a daily basis. And if you relate to any of these statements, then this is a trigger sign to know that you are dealing with burnout. The first thing I used to tell myself when I was a medical intern is that I can't handle this anymore, which is emotional exhaustion, according to Maslach. The other thing that I would tell myself sometimes is that my patients or my coworkers are so annoying. And this is a statement that means this is framed as depersonalization when it comes to burnout. And then finally, and perhaps worst of all, is I'm not doing enough, right? I've done so much to get through med school, and now I'm finally on the front lines and being the doctor that as I hoped to be. But then I constantly feel like I'm not doing enough, I'm not good enough. And this is called low self-efficacy or low professional fulfillment or low professional achievements. And those three together make up what burnout looks like in terms of a clinical picture, if you will. And perhaps worst of all is that I would rather die at that point. I would rather end my life rather than tell anyone about these three things. And that is because it was so intertwined with a sense of shame that I was not able to really acknowledge. And more about this in a second. But really, I think what also exacerbates the problem, other than not being able to talk about it, is the role that technology has played over the past years in it. And I think what a lot of people do not understand about technology is that it doesn't always help humans. It's sometimes we put technology on a pedestal that is higher than how we treat other humans or how we work with humans. And so especially when I moved to the States and I went to Boston, healthcare stopped being this highly empathetic profession that is based and rooted in compassion and connectivity, and rather became like this. And that's what we're seeing now. Physicians staring at their screens, being asked to input data and becoming essentially data collection machines rather than compassion and empathy givers to their patients. And so technology has taken away a lot of what we value the most as physicians in the practice of medicine, which is relationships. And so once that is taken away, along with what we were talking about with admins, decreasing the amount of time and increasing the amount of paperwork that we have to do, that altogether is what has been snowballing into the problem of burnout that has been increasing and significantly increased over this generation than the one before, because it has become overwhelming. And so what I've spent the last 10 years thinking of is what is missing. And the best word that I found is this word gumption, which is this sense of it's like a hot air balloon that helps you soar across the sky. And that is what work should look like. It's a feeling that you get when you are basically in the right place, in the right time, doing the thing that fulfills you the most. And that's not been the case with medicine anymore. And if you're not familiar with gumption, it's a Scottish word, but also it's chutzpah in Yiddish. And what I really want you to understand is that the thing that takes away from gumption, the thing that actually causes most of the burnout, is not individually or us being weak as physicians and need some kind of training. It's actually a broken healthcare system that does not value human relationships and does not value the doctor-patient relationship as much as it used to. And so one thing that's really important before I get into what we can do versus burnout is to understand that it's multifactorial, and it's based not just on your individual life and what you do as a person, but also where you work is a huge part of it. And so what I want you to really remember, if you remember one thing, is that if your employer is asking you to work 100 hours a week and is putting all these obstacles between you and your patient, and you're having to spend most of your time after work inputting data into the EMR when you're back home, then it simply does not matter how many hours you exercise or how much you meditate, because you probably don't even have time to do that or sleep or eat well. And it's really important to look at the balance here between both these things when we're looking at it. And so if you are on the other side, if you're an executive or you're an admin and you are listening to this, then I don't want you to be scared of this conversation. Because if you realize the amount of burnout that's happening in your organization, then no one else has to. If you look alongside patient satisfaction, revenue, and cost at how fulfilled your physician and your healthcare workers generally are, then you are on the right track to actually bring fulfillment and make your organization a great place to work. Currently, this has not been a metric that we're putting on the dashboard or putting on the scorecard. And anyone that has worked in HR knows that what gets measured improves. We're not measuring it enough. And so I'll get back to this also in a second, but I also want to tell every physician out there that you are supported. There are many organizations where you can find resources and find peers that actually value fulfillment and value joy in medicine. And if we are to change this for generations to come, we need to come together. And it's time for physicians to really bind and share their stories together so that we can get ourselves out of this bind. And again, if you leave your email on gumption.health, I will send you all these resources and connect you to these organizations that you can share your stories with, but also realize that you're not alone. And that's a big part of it. That's part of the mental trick that we fall into. And that's what I felt when I was an intern. Like I felt like I was alone. I was the only physician that was experiencing that, right? And so this is the roadmap that I have come up with and put together when it comes to, what are the evidence-based techniques that we can both heal from burnout with, but also measure it, more importantly, and put it on the dashboard. And so what I first want to talk about is emotional regulation, because emotional regulation is something that you can do in the moment. You can do it right now if any of this, if this like conversation is triggering for you, or you can do it later today if any of your patients or admin annoy you. So these are things that you can do within seconds or minutes, and that's why I'm starting with them. Having said everything that I just said, there is a way for you to immediately regulate your emotion, and that is key. And that's not something that I learned when I was in medical school, but there are essentially three elements to emotional regulation. The physical side, how do we simply regulate our heart rate and variability, our emotional side, the awareness, and then finally compassion, which is again key to the profession of being a doctor, but also to regulating yourself and preventing burnout. And so again, these tools were not available to me more than 10 years ago when I was a medical intern who graduated from Egypt. That's me on the left, and then went to Tufts Medical Center in Boston. And I was just caught blindsided like a deer in the headlights with this whole burnout thing. I did learn about the vagus nerve, and we all understand that the vagus nerve goes throughout our whole body, hits more organs than any other nerve, and is responsible for the parasympathetic system, which is the system that gets us into the rest and digest phase. What they did not tell us in medical school is that there is a way that is accessible for us to immediately start activating that vagus nerve and give a message to our body to relax. And that's very effective. And there's a breathing technique where you inhale for 4 seconds and then exhale for 6 seconds or longer. So essentially, when the exhale is longer than the inhale, your body activates that parasympathetic system and brings you back from the stress of the sympathetic system to regulating, bringing down your heart rate. And so if you are wearing a Fitbit or an Apple Watch, you can try this out right now. Look at your heart rate and then do this breathing technique where it's 4 in, 6 out. And after 10 or 15 times, you'll see your heart rate actually decrease. And that's the first data point. Like, how fast is your heart beating? That's the simplest and most straightforward way to measure your stress. And once you do that, once you gain control over your physical body, you start realizing that there is a whole lot going on emotionally that you're not aware of. And we tend to quickly project it because it's so uncomfortable. But once you've controlled your heartbeat and your respiratory rate, then you can start looking at your emotions and be like, how do I feel right now? Which is something that as physicians, we tend to, I'm not going to say like undervalue, but we tend to overlook. And there is a lot of validity. Like, are you feeling disappointed at your patient? Are you feeling annoyed? Are you angry at your employer? Are you are you sad? You know, are you feeling really jealous? Are you happy now with your children? Like, all these things are valid, and we tend to think more about how should we feel rather than how do we actually feel. And so this is a second data point. Like, on a scale from 1 to 5, how do you feel? 1 being, you know, really depressed, to 5 being ecstatic, and everything in between. If you just start mapping this out next to heart rate and variability, you'll start to have an accurate picture of even, like, what things happened to you in life that caused the burnout. And then the beautiful thing about understanding your emotions is then you understand what it is that you need in a certain moment. So remember, these are all things that you're doing when you're triggered, when you're feeling the adversity of a certain situation or context. And self-compassion is huge, and you can only do it once you have the mindfulness of, this is how I'm feeling. So then what follows is, all right, well, what do I need? And it sounds very simple, but a lot of us can't allow ourselves even to do it because of this like superhero complex. And one of the greatest books that I've read and that have really allowed me to understand this is Compassionomics. I highly recommend it to anyone in healthcare, not just doctors, but it really talks about how compassion is at its lowest level and how it can be the cure and the antidote to shame and burnout. And how actually, like, even patient outcomes and patient satisfaction, which administrators do care about, can be improved by just increasing compassion. Now, another scientist that I really like is Kristin Neff. Dr. Kristin Neff has studied compassion and broke it down into really a process of 3 steps. First is the mindfulness of how you're feeling, which you talked about. And then second is the idea of global humanity. So it's not just you that is going through this. And that's a very powerful, extraordinary powerful tool to just remember that you are not the only one that's going through this. As a physician, you have a lot of people that are experiencing this with you, probably in the same time, but we're all locked in not being able to talk about it. And then the third thing is giving yourself what you need. And that's how you close the cycle of self-compassion. And that can be very simple, very simple. Like, sometimes you just need a meal, you need to sleep. And I'm not saying that's the cure to burnout, but sometimes that's the way to bring yourself back to the moment and say, you know what, it's a signal again that you're sending to your body that you are valuable and that nothing else can be more important than taking care of yourself. Because the adage here is that you need to put your oxygen mask before you give it to others, and that's exactly what self-compassion helps you to do. Again, one of the resources that I would share with you if you send me your email or connect with me afterwards is the self-compassion score, which is a fantastic tool to actually identify on a scale of 1 to 5, based on Kristin Neff's research, where you lie on all these different metrics. So there's also all these subscales. So measuring self-compassion is something that we can do and something that is extremely valuable. Brené Brown is also another one that's talked about shame and talks a lot about how shame dissipates completely as soon as you put it to the light. So think of shame as this gremlin that is hiding and lurking in the shadows of our brains and will only be destroyed if we put it to the light, meaning that if I come to you and be like, you know what, I'm feeling really tired and exhausted, and I feel like I can't do this anymore, I feel like I'm a bad doctor, naturally you will talk to me like, I'm your friend. And sometimes we tend to talk to ourselves as our enemies, or talk to our friends better than we talk to ourselves. And so Power of Vulnerability is another great book that I highly recommend about shame. And then finally, Dr. Mark Goulston wrote this book in the pandemic, and he's a psychiatrist. And he, again, talks about this idea that we as physicians tend to fall into this category of overachievers and people pleasers. And what's fascinating about his work and I had the chance to have several conversations with him, and what he taught me is that frequently when we go into the practice of medicine, we go in because we have this relationship with our parents or someone that's close to us that's telling us, you need to do more, you need to do more. And so we are like totally in this overachiever kind of mentality, but also we're trying to please our parents or our mentor figure somehow. And this can be really motivating when we're young. But what happens when we start, our parents' roles fade away with time, and we start projecting that relationship onto our employer. So then we're trying to please our employer, or we're trying to please our coworkers or our patients, and we forget about ourselves. And that's a key to understanding that, how do we shift that? How do we rewire that so that we give ourselves what we need first? And that's a basic tenet of self-compassion, which is the biggest well-documented antidote for burnout. And so this is a great practice. It's a little more advanced than just measuring your heart rate or breathing, but those are the three things that are that lie under emotional regulation. Those are three things that you can do today and start practicing every day. And those are the basic tenets that then allow you to start looking around you. And so once you've regulated your internal state, then you can start making change and impacting the world. And that starts with a proper assessment. And so this is the next section that I want to talk about, is how do you assess how much burnout exactly are you feeling? And then how much your environment is causing this burnout. And that is all before wellness. And I'll get into wellness later, but it's really important to say that before we start implementing wellness tools, we have to figure out, are we working in the right place or not? Are we in a place that's actually that actually cares about our success and fulfillment? And so assessing burnout has become something that's really easy to do. And I have at some point in my career made the decision that in order for me to reach professional fulfillment, I need to leave medicine. And I was lucky enough to have the ability to do that, or leave the clinical practice, because I didn't have like all the medical debts that a lot of physicians can get stuck in. But basically, the importance of assessing burnout is that if we want the next generations to continue being in medicine, which is becoming less and less likely that people would actually join, and it's becoming less and less recommended as a profession, then we really need to be able to take, again, a bold look at our organizations and how they're doing it. And so if you are watching this, I will walk you through how to actually assess your organization right now using Christina Maslach's areas of work-life balance, which are the 6 things that you and I, Swastik, were talking about earlier. And so if you go to this link, bit.ly/wellnessradar, you'll see something like this. And you can actually fill it out and see a visualization as I walk you through the different elements. And so there are 6 elements that she talks about. And ultimately, hopefully your professional fulfillment hexagon will look like this. This is a pretty good organization. And so as I walk you through each one, you can also put your name here. And then as I walk you through each one, you can put a number and it will start mapping it out. Hopefully it looks more like this rather than this. If it looks that small, then there's some drastic change that needs to happen. Usually it's going to be a mix of both, or you're going to identify one of these things that's really bugging you, and then it just opens up a conversation with it. This has been studied over and over again. Christina Maslach is the world's leading researcher of burnout overall. And so, all right, get ready. We're going to take a deep look into the organizations. And the first thing I would like you to put in that radar chart is control. And so you're going to put control on the left, and then you're going to rank it from 1 to 10. And control really means autonomy. So if you are able to prescribe any medication to your patient, you're able to spend as much time as you want with them, then you're more on the 10 side. If you are limited to 5 minutes or so with your patient, you have to do all this paperwork in order to give them the medication that they need. If you're feeling like you're very low on autonomy and you can't make the decisions for yourself, then you're more towards a 1. So really quickly choose a number between 1 and 10 when it comes to how much control you have over your workload or over your work, and especially over like caring for patients. Then the second thing is workload. Sometimes we think of burnout just as workload, and so it's really important to know that it's only one of 6 things that affect you. You can be working, an incredible number of hours, but the other factors are like helping you avoid burnout. But so this is the one where how we usually think of burnout. So how many patients are you seeing per day, and how many patients are expected to see per day, but also how much EMR work do you have to do? How much documentation work do you have to do? If you're working like 100 to 120 hours, you're definitely on the one side. But if you're working, less than the required like 80 hours, or you have a lot of free time to, have a weekend with your family, then you're closer to the one. So choose, what number from 1 to 10 really represents your situation. And then the third one is community. And this is huge because burnout is heavily intertwined with the idea of loneliness. And we're not just lonely in terms of our thoughts. Like, I said in the beginning, like a lot of these symptoms, when they come up, we don't want to tell anyone. And that creates a sense of loneliness or isolation. But with COVID, we've been like physically lonely too. Like it's not just that we can't like communicate or touch our patients, but we can't also really be around our families. And so community and isolation is a huge proponent of burnout. And the people that you work with at your job are a huge part of the factors that lead to burnout. And so again, from a scale of 1 to 10, 10 is like, I can't wait to go to work, to be with the people that I work with, and I love hanging out with them, and I can't wait to meet nurse so-and-so and doctor so-and-so. And 1 is like, oh my God, like I wake up and I just can't fathom the idea of going to work and being with these people again. And so 1 to 10. And then 4th thing is fairness. And fairness is really like how much of a ceiling do you think there is between you and growing in the organization? Meaning that if you're close to a 10, if you are feeling that there is equal reward and if you work hard, you'll get rewarded, well and stuff. And there basically like there's no discrimination based on your age, religion, or any belief system that you might have. Whereas 1 is an organization that highly values people of a specific color or people of a specific ethnicity, and it makes you feel that your belief system is kind of getting in the way of you advancing in the organization. Number 5 is reward. And we tend, as physicians, we definitely value our relationship with patients. That's kind of what energizes us and keeps us going. But then this aspect is specifically about money. So if you feel like, compared to the amount of hours that you put in, do you feel like you are getting rewarded in a way that does not make you think about money much in your life? So this, take your lifestyle into consideration here. But do you feel like 10 is you feel like you are getting paid enough to cover everything you need to do, and maybe ideally save some money, and you're not having to think about other jobs. Whereas 1 is like you're getting paid peanuts and you have to think about 2 or 3 other jobs, and you're having to take part-time work at multiple hospitals. And this is like, again, a key element in how you think. The last option, and I hope you guys are following, you should have 5 elements now in your spider chart. The last one is values. And the example I like is like if you care about climate change a lot, because we already used the climate change example. If you care about climate change, let's say, and you're working for ExxonMobil, right? You're at a 1. Like you can't be, you can't get around the fact that your values are so different. But let's say if you really care about your patient relationship and believe that physicians should have as much time as they can with their patients, and your organization actually thinks about that, it's kind of idealistic. But if your organization is like, yeah, spend 2 hours with them, we don't care, then your values are kind of aligned. So based on your own value system and the things that you like and think are important, how much do you think your organization actually values them? And sometimes we forget to think about that, but it's a really critical component. So now you should have 6 elements. And what I like to do if we're doing this live is to actually break you up into 2s. So maybe, find someone else that you work with and walk them through these 6 things and just have a discussion about it, or do it with your spouse or even with your employer if they're open to it. and start talking about which elements need improvement and what's one thing that you can do or ask for to improve your burnout results. And so let's say if community is like a 1 or a 2, then what can you do there? If everything else is good, then what can you do to actually improve it? Beyond like birthday cakes, like what kind of activities can people do at work to actually improve that sense of community? And then you're bringing that sense of autonomy to yourself, because maybe you can actually improve it for both yourself and your organization. But ultimately, if you're ranking low in 4 or 5 of these, then you just have to start facing the fact that sometimes organizations do not have our best interest in mind. And as the world changes and as people understand burnout, then you might be better off putting a cap on your practice and starting to look for work elsewhere. And that's just the brutal fact. Because a lot of executives and a lot of people who are running healthcare, quite frankly, would prefer not to look at the problem and prefer to keep pushing the doctors to do more. We're like this factory mentality, which just does not work for healthcare. And so these people are going to ultimately realize it. And again, that's the idea that the dashboard and the metrics need to take how you feel and your risk of burnout into consideration. And these 6 factors should be on every hospital's dashboard, because it's going to affect your competitiveness in the future. And as physicians, we need to understand that we are very valuable resources. It costs a lot to train us. It costs a lot to hire us. And so your employer might not care right now, but they will care in the very near future. And so let that be a very empowering thing for you. Now that's how to assess it organizationally, but I would also encourage you to go check out the Mayo Clinic Wellbeing Index. And again, that's one of the things in my resource packet that I would send you. But this is a study that was done on tens of thousands of physicians. And it can, by answering this quick 7-question survey, very simple, you can tell exactly what your risk of burnout is right now. And that's something that I encourage clients that I work with to assess on a monthly basis, just to see where I'm at and how things are going. And so that brings us to the end of the second part, which is the assessment, right? And we're going to go pretty quickly through the last 3, the last 2, or the third and fourth elements. But it's really important to, again, not fall into the trap of wellness, because what the industry as a whole has been doing is jumping straight into well-being and biohacking and creating wellness programs, meditation programs, and so forth, without actually looking at the problem and assessing where is it and what's going on, or teaching doctors again about emotion regulation, which is key. So only once we've identified that, okay, now that you know how to regulate yourself, you've taken control over your internal world, and you understand how your external world affects you, then you can start looking into the nirvana of wellness and well-being, which is really looking at the different metrics and the different data points that show you how vital you are, and doing the same thing that we do for our patients, looking at the vital data and looking at the labs and saying, okay, this is how my body is functioning. Because what happens when we trap all this suffering and pain emotionally and not deal with it, it then starts manifesting in our bodies. And that's a real consequence of burnout that you have to stop and look at again, because the American Journal of Medicine also shows that, wellness is only the basic pillar, but there are many things beyond that, such as safety, respect, and appreciation that we have between that and healing patients and contributing. So again, wellness alone does not work. It has to come from, again, compassion and regulation and understanding and a bigger conversation. And I don't blame executives that jump into wellness and now we're seeing chief wellness officers everywhere, but I fell into that trap myself. And this is a program that I did based on my fascination with functional medicine and well-being. And when I was first trying to fix that problem for others, I jumped into the conclusion that wellness is the thing. And this is the branding that I built for a program that I shut down pretty quickly after realizing that we as physicians are already resilient. Even the name that I chose was Resilient Doctor. It looked nice and everything, but it still propagated this idea of a superhero. And that was a mistake that I did. And I actually found that the program, because it didn't tackle emotional regulation and organizational readiness, it actually pushed doctors towards higher stress. So with all that being said, wellness is critical and important, but you can't do it without knowing that your organization and your place of work actually cares about it and will give you time to sleep and meditate and exercise. Because like I said in the beginning, Medscape's surveys show that we as physicians obviously know that. Like, we know that we need to sleep and we need better diet. Like, we're telling our patients that all the time. And so the fact that we're not doing it is not because we don't know. However, once we're in that place where we can actually experiment with these things, there's a fascinating set of tools that I'll get into the next section into deeper detail. But basically, all these biometrics that allow us to see heart rate variability throughout the day, how much sleep we're having, those are key for us to, like, in retrospect, look at what's going on. And also our labs. Like, when I was doing that program with physicians, we would measure sugar metabolism, lipid metabolism, cortisol, AM and PM. And it's fascinating how much information you can tell, and you can actually see some of these physical manifestations of how you're working. And then finally, the science behind inflammation and inflammatory mediators such as tumor necrosis factor alpha and interleukin 6. Those are all mediators, things that can be measured in the blood that have been shown to correlate with burnout directly. And so there are ways for us to keep tabs on burnout on a biological level, and we should totally make use of these tools. And again, I didn't want to spend too much time on wellness, but there's a whole list of interventions that we can do when it comes to wellness. And looking at, again, the thing I forgot to mention is that there are, from a functional medicine perspective, 5 pillars. So exercise, nutrition, sleep, stress, and relationships, which are, again, relationships is where the compassion lies, where your relationship with your employer, relationship with your family, your relationship with your patient. But then I would add a 6th one, which is addiction also, which is a huge problem that comes from burnout and is highly intertwined with burnout. And so this diagram requires addiction to be added too, because that's one of the things that we've seen soar so high when it comes to physicians and burnout after COVID. And so finally, once you're talking about all this advanced tech, and I apologize, this is a typo here, but advanced technology, we can't start talking about it without having said all this that I just said. And so I'll quickly take you through a tour to wrap up this talk with what does the future hold what does the future hold when it comes to a burnout-free culture and a burnout-free future. And I think a lot of the technological advances that are going to come are going to play a very interesting role when it comes to that. So first of all, let's get rid of the electronic medical record data entry situation, because it's draining physicians. The numbers show it really well. It's really well documented in the States, and now in the Middle East that we're starting to implement electronic medical records. We do not have to wait 10 years to deal with this problem. And so we can leapfrog it, knowing what happened in the US and Europe. And so one of the things is like voice commands and transcription services that are becoming ubiquitous, so that doctors can actually capture the notes in a structured manner that can be analyzed without having to do it after their work. This is going to be huge. A lot of big players are coming in, including Amazon and Google, and it's there's already like Dragon, if you guys are familiar with it. Nuance is a huge company that just got sold to Microsoft. So this is the future where physicians are seeing the patients and everything is being documented there. The second thing we need to understand is that computers also can crunch data and numbers way faster than any other time before. So computers do not grow linearly. Their technology has been growing exponentially. And when it comes to us being able to identify trends, predictive patterns, so precision medicine, AI, and machine learning is growing exponentially. The amount of studies that have been published in medicine is what you see here. It's, again, like an exponential curve. And so the amount of things that we can do when we collect all the data that I just talked about is to actually predict in the future which path will lead to least burnout. So think of it as like Google Maps that tells you if you take this highway, you're going to be late. But if you take this other highway, it's going to be, blue and not red. And this is the kind of stuff that we can start doing when we have this data, and looking at kind of when burnout is going to happen. But then, okay, once we predict it, how are we going to treat it? And that brings me to one of my favorite innovations and favorite areas under digital health, which holds the whole promise, I think, of technology in healthcare, which is called digital therapeutics. And digital therapeutics are essentially apps that have shown to provide specific outcomes. And so we have thousands of apps now on the store that claim to be health apps. But with digital therapeutics, they basically bring remote monitoring and AI tools along with teleconferencing all together in like one platform that can actually help you cure or prevent a disease, or even optimize medication for a disease. But even better, they can actually replicate, or they can replace medications completely in some cases, because they have shown to be as effective. So now we're seeing digital therapeutics for diabetes, for Alzheimer's, for hypertension, for heart failure. What if we have a digital therapeutic that serves the doctor for burnout? And these are behavioral change modifications and interventions that have been proven to work. And now there's a way with the FDA, or in Germany with the DIGA, to actually go and show that this actually gives that outcome every single time. And then genomics, because we simply can't know where we're going without knowing where we come from. And there's now a lot of research going into the idea of trauma and mental health that may even go beyond our lifetime into our parents' generation or our grandparents' generation. And something that was unresolved there might actually be manifesting as part of us. And there's a fascinating body of science that's behind that now. Dr. Gabor Mate is one of my favorite people to follow and he's a psychiatrist that also understands the problem of burnout. But the more we're able to sequence our genomes, and of course that opens up a huge ethical question about what happens when we know that one physician is more liable to burnout than another physician, because we don't want organizations to only be hiring those. So there's a ton of research that's showing that specific gene markers can actually determine that. But what we're going to do with it is what's next. And one last thing that I'll mention is also like Web 3.0, like blockchain, decentralized data collection is going to be huge, I think, when it comes to the area of burnout, because ultimately the problem with collecting all this data that I mentioned with you guys is that there's a lot of paranoia around it, right? Like what are we going to do with all this data? And then goes back to the ethical dilemma, like can my insurance company know that I'm burning out? Can my organization know, or my future employer know that I've burnt out before? And blockchain, there are a lot of hurdles to pass by, but it's by far the most promising technology when it comes to allowing physicians to actually start inputting some of these surveys and inputting some of these scores. Because even when self-compassion becomes mainstream, are we only going to hire the physicians that have high self-compassion scores because they're going to be, less burnout and more productivity? These are the questions that are going to face us, but the future is very bold and brave, my friends, and I hope you are too, because there's simply a lot that we can do together and a lot that we can start, once we start pumping our own balloons, so to speak, and understanding that our organizations may be putting a ceiling on how high we can fly. And we start actually taking things into our considerations and taking like these organizational matters into consideration, but also taking things into our own hands. We can rise together as physicians and claim healthcare back for ourselves and for our patients. And so that's my hope for you. And that's what I hope you have gotten from this, is that there is a way for us to work together. And there is a way through this, and the future is very bright. So don't let any organization tell you what you can and can't do, and don't feel stuck in a job that simply is not allowing you to fill yourself with that sense of gumption. And finally, I shared a lot of information today, but connect with me. This is my email, and if you leave your email in gumption.health, then I will send you all the information around like the studies that I've cited, and also like this deck if you need it.